To talk about furcation invasion or furcation involvement in my next video. Before that, I thought like, why not we go for anatomy and anatomic variation of multi-rooted teeth before understanding furcation invasion. So as we know that we are blessed with a different number of teeth, as we see the permanent dentition, we have 32 teeth, 16 in the upper arch and 16 in the lower arch. But out of these teeth, few teeth are multi-rooted, like our tooth number 14, 16, 17, 18 we don't consider because we don't usually treat it. So in upper arch, tooth number 14, 16, 17, and if you see the opposite side, 24, 26, and 27, whereas in the lower arch, tooth number 46 and 47, and tooth number 36 and 37. If you see the anatomy of such teeth, this is the anatomy of these teeth are different than the anatomy of the single rooted teeth. But due to some anatomic variations, tooth number 1, 3 means canines can also be multi-rooted, but normally they are not. Normally they are single-rooted. But due to any anatomic variation, they can be multi-rooted as well. Okay, but not very common. So the multi-rooted, because we are talking about furcation, it means furcation will be only present in the teeth with two roots. Single-rooted teeth do not have any furcation. So the teeth with multiple root have they contain the furcation point. We'll be talking about what is the furcation point and why it is essential to understand if we are talking about perio. So this is tooth number. You can say a maxillary molar can be right side, can be left side. If we see exactly this tooth, if you see that this tooth has one root, another root, and another root. So it is having three roots. If we see maxillary first premolar, it has one root. And you can see nicely here the shadow of the second root, okay? But since we are looking from one angle, that is facial angle or buccal angle, the other root, the opposite side one is hidden. So I will turn the tooth in other direction, we can easily view the roots properly, either in the mesial direction or from the distal direction. And this root, these like if we come to the molar, tooth number 6, okay, the upper arch, tooth number 6 of upper arch or tooth number 7 of upper arch, they are having three roots. One is this, that is called as buccal, means buccal is divided into two, mesiobuccal root, distobuccal root, and a palatal root. There can be variation, rarely, but it can have four roots as well. So, multiple roots are present into the teeth with upper 6 and upper 4 normally, and upper 7. Okay. Similarly, we go for the lower arch. In the lower arch, we have tooth number 6 and tooth number 7. They are also multi-rooted, but normally they have two roots. One is the mesial and one is the distal. But there can be anatomic variation. It can have three roots, but again, this is rare. So these teeth are multi-rooted teeth. It means they have roots more than one. When the teeth with more than one roots are there, they have some, different problems that are occurring. We will talk about that. But first, we need to understand what is this region. Basically, the point from where the roots divide. This is the exactly point from where the roots are separating or they are dividing. This is called as furcation region. Furcation region for the upper teeth and furcation region for the lower teeth. Exactly from this point when the roots separate, this is called as furcation region, and this furcation region where there is a separation of the two roots is called as furcation entrance. If you see exactly this point from where otherwise there is no separation, this is one component. Okay, that is called as root trunk. We'll be talking about it. But from the root trunk, there comes exactly a point from where the roots get separated. The trunk is separating the roots into two. And this exactly region from where they're separating, this is called as furcation fornix, this point. And when there is separation of the two roots, that is called as entrance. Means this is the point where the bone enters and bone forms between these two roots. And this bone is called as interradicular bone. Multi-rooted teeth have interradicular bone, whereas single-rooted teeth do not have interradicular bone. So this is exactly the point of separation where the bone forms. That is called as interradicular bone. But what if the problem exists, like periodontal disease occurs? This bone, which was present over here, this bone starts to resorb, leading to invasion of this region, and that is called as furcation invasion. We'll be talking about it in a later video. So root separation, and that was the fornix and entrance. Now, before I said, like, there is a structure that was coming below the crown, was complete one piece structure that was called as, or that is rather called as root trunk. This is though a part of a root, but it is a trunk. Trunk is one piece where there is no separation. Below the trunk comes the point where the roots are separated. So this is called as root cone, where the separation occurs. The two separate segments or three or four separate segments are called as root cones. And the point which is not separated, this is one unit above the root surface and below the crown surface, that is called as root trunk. And together we call it a root complex. Together it is called as root complex. Now if I see this root complex from above, means from this point, if we see exactly from this point, how will it be? It will be like this. One root, another root. This is the one root, another root. This is means these are two buccal roots, mesobuccal, distobuccal, mesobuccal and distobuccal, and this is the palatal root. If I see exactly this furcation region, this root is indicated here, this root is indicated here, and this root is here. Now we are looking from the top. When I see from the top, I see there is a different sort of anatomy present. If I see the region where basically this is the trunk, if we see the trunk is somewhere here, this is the region of the trunk, and this is somehow the floor of the trunk. So this is the floor of the trunk. This floor of the trunk is called as furcated region, where the furcation begins. And the furcation begins in different way. If it is two-rooted tooth, means bifurcation, then anatomy of this region will be different. If it is trifurcated, the anatomy of this region is different. Still, we are talking about the upper molar. 6 or 7, we said it has 3 roots. So this furca region will be separated into, if you can see here, mesial furcation entrance, distal furcation entrance, buccal furcation entrance, and palatal furcation entrance. If we exactly see, this tooth has 4 entrances for furcation. Okay, if I exactly see from here, this is the buccal root, this is the mesobuccal, this is the distobuccal, and this is the palatal. If I take my probe in, I can nicely enter from here. I can nicely enter from here. I can enter from the mid. And if I come from the palatal region, I can enter from the palatal region as well. So these are called as furcation region or furcated regions. And these regions are actually important to check or evaluate at the time when we want to see invasion of this furcation region. And if we see anatomy of the roots, if the roots are divergent, as this is the case, the degree of separation is more. If we see exactly this tooth has this buccal root, mesobuccal, distobuccal, and palatal root. So these 3 roots, they are separated in a way they're divergent. The roots are divergent, separated nicely. So this is called as degree of separation. The divergent root has good degree of separation. Why it is important? Because it is important when we'll be treating such problems. Normally, don't consider now, we are not considering as it as a problem. Now, we are just trying to understand the anatomy. But in the cases where the degree of separation is reduced, means in cases where there are convergent roots, they will cause some problem to the treatment if I increase the convergence, even more. So the closer the roots are, there is a reduced degree of separation. The more the divergent roots are, there is increased degree of separation of the roots. And this degree of separation of roots will come, we will talk about the treatment in upcoming videos. So together, along from the trunk and from the furcation fornix, if I want to see the degree of the separation, there is one way of degree of separation as we saw, that was from fornix till the root tip. This is one way to see the separation of the root. We can see again the separation of root from the upper part of the trunk till the apex of the root. These are two ways to see the coefficient of separation. This is called coefficient of separation. Coefficient of separation is from the trunk, the topmost part of the trunk, till the lowest part of the root apex, as denoted as B, and from the furcation fornix till the root tip is called as A. When we gather them, or when we divide them, A upon B, then whatever the digit comes, that will be your coefficient of separation. Means how much roots are separated from each other. So we said that the molar tooth, again we are coming back to the first molar. I'm taking first molar as a reference. It could be second molar maxillary as well. So we said the upper first molar has two roots, two buccal and one palatal. These two roots, if we see of this tooth, they are actually making 3 to 4 furcation regions. We have 3 to 4 furcation regions. If we see, this is actually the angle of the tooth we are looking at right now. This is basically the angle we are looking at right now. If I turn the tooth in some other direction, I will have, if I turn these buccal roots in this way and the palatal root to the other side, then I will have this view of the tooth. These are two buccal roots and this is the palatal root. Similarly, if I turn the tooth in a different direction like this, so the two buccal roots coming this way and one palatal root going this way. Basically, the reason behind is we want to see the furcation points. So this tooth basically has buccal furcation, one point of entrance. It has mesiopalatal and it has a distopalatal furcation point. Mesiobuccal, distobuccal, midbuccal, even we can have palatal furcation point. As we said in the image before, that the furcation region, if we were looking, when we were looking from the top, as in the image we saw earlier, as in this image, so this multi-rooted molar has mesial furcation entrance, distal furcation entrance, buccal furcation entrance, and palatal furcation entrance. So means we can enter into the furcation from 4 different points and it has 4 different furcation regions. But similarly, when we talk about tooth number 6 in the lower arch, since we said that this tooth has 2 roots, so it has only 2 furca regions, 2 furcations. Either you go from the buccal side or either you come from the palatal side. So it has 2 furcation regions basically. And the tooth with trifurcation had more furcation regions to enter in. So this is basically the furcation point of this tooth on the facial surface. And similarly, if I turn the tooth around, similarly, I'll have the same furcation point on the lingual side. So it has only two roots and one furcation. You can either enter from the buccal side, you can either enter from the lingual side. So there are so many other variations which can occur into this furcation regions due to anatomic variations. They can be cervical enamel projection. There can be presence of enamel pearls. Then there can be present of root concavities. They are actually anatomic variation. They cause problem with cleaning. They actually their presence rather amplify the bacterial invasion. Their presence rather amplify the bacterial niche to stay for a longer there, because these anatomic variation cause trouble with cleaning of this particular region. If patient has problem, there is accumulation of the plaque or accumulation of the calculus. These anatomic variation do not allow proper cleaning. They rather help bacteria to stay longer because of variation. Whatever procedure patient do, like interdental brush if patient use, or patient tries to clean this area, he fails. Even if we try to instrument this area, when the patient comes for the treatment, they produce difficulties to us. And if even we try to regenerate, for example, when we're talking about the regeneration thing, these variations or anatomic variations cause trouble during the treatment. So there are a lot of different problems that occur in the furcation region. These are called as cervical enamel projection, cervical enamel pearls, concavities, the presence of grooves, etc., etc. So that was all about the anatomy of furcation region. If you have any question, you can call me on my WhatsApp number. I always share, and you can ask me via comment in the comment box. And I have taken this all material from these two books. That is a clinical periodontology book of Carenza and Linde. Thank you so very much.